Hello, good evening, everyone. My name is Sophie Hayes, and I'm the nurse at Integro Medical Clinics and the clinical lead of CPASS's Nurses Arm. I'm here to welcome you to this collaborative webinar discussing cannabis medicines for fibromyalgia and arthritis part 2. This webinar is brought to you by multiple collaborating organisations in the UK medical cannabis space. UK Fibromyalgia, which is an organisation that seeks to help the fibromyalgia community by publishing a monthly magazine, newsletter, and running various social media campaigns to provide those in need with advice and increase awareness. The Primary Care Cannabis Network, an organisation specifically designed to support GPs and their patients' needs when it comes to cannabis medicines in the UK. And this organisation is collaborating with us on this event as they believe through shared experience and learning, a more balanced opinion of cannabis medicines can be presented. I totally agree. Cannabis Patient and Advocacy Support Services, a non-profit organisation providing education, advocacy and support for patients and healthcare professionals with a particular focus on nurses considering cannabis medicines for their patients. And Patient-Led Engagement for Access, or PLEA, is a proud volunteer-led non-profit community interest company established to challenge the inequalities to cannabis-based medicinal products in the UK, who have just celebrated Medical Cannabis Awareness Week last week with multiple events that you can watch on their channel, I'm sure. And finally, Integro Medical Clinics, which is one of the few private clinics able to prescribe cannabis medicines in the UK. The expert team of doctors there value their patients and provide gold standard medical care in this emerging field of medicine. If you would like to get in contact with the team at Integro Clinics, the details will be provided at the end of this webinar in an email that goes out to everyone. Similarly, if you are interested in exploring any of the organisations I've mentioned further, there will be an email going out following this event that will include everyone's website links. You can go and have a look and get involved. Okay, so for this evening, our focus is on fibromyalgia and arthritis. There are an estimated 1.5 to 2 million people living with fibromyalgia in the UK. The condition can often take years to diagnose correctly and can take even longer before the symptoms are brought under control. This is the second of a two-part education series, and this will be a roundtable discussion with experts and patients who will talk about managing their conditions through the use of cannabis medicines and CBD and their experience prescribing them. It's my personal pleasure to introduce our speakers this evening, all of whom are incredibly knowledgeable, experienced, and passionate about the field of medical cannabis in the UK. We have Dr Anthony Ordman, who's the founder of the highly respected chronic pain clinic at London's Royal Free Hospital, a specialist practitioner in pain medicine for the last 30 years. Dr Ordman is the immediate past president of the Royal Pain Society and also lead clinician at Integro Medical Clinics. Dr Leon Barron is the NHS GP, founder of the Primary Care Cannabis Network I mentioned earlier, and a key member of the Medical Cannabis Clinician Society. Mary Biles is the author of the CBD Book, The Essential Guide to CBD Oil, regular contributing writer for Californian educational nonprofit Project CBD, and host of the podcast Cannabis Voices. She's also the chief editor at CPASS's Nurses Arm. We've also got Stephen Spencer, who's a patient living with FSH, muscular dystrophy, dyspraxia, dyslexia, fibromyalgia, ADHD, and PTSD. Currently prescribed cannabis medicines for his pain and related symptoms. Stephen is passionate about medical cannabis and supporting patients in the UK. We have Anne-Marie Bard, who's a patient living with fibromyalgia and up until very recently was practicing dental surgeon and CEO of her own practice. She says she feels cannabis medicines have allowed her to have a new normal after using cannabis to safely reduce the amount of opioids that were prescribed for her pain. And Gillian Flood, patient living with fibromyalgia and PTSD, mother of 5 and member of PLEA Management Committee, where she plays a key role in educating and advocating for patients when it comes to cannabis medicines in the UK. So it is a real privilege to be part of this particular roundtable discussion with such inspiring individuals. So thank you everyone, all of you, for joining us. Thank you guys for joining us this evening, the audience. I'll be monitoring the chat during the presentations. If you would like to ask one of our panelists a question, put it in the chat and I'll be moderating that chat for question and answer session, which I will hold at the end of this session. So thank you for everyone for bearing with me through all those introductions. I'm going to start with asking Stephen, if he would so kindly start by sharing your patient journey with cannabis medicines.
Hello, and thank you very much. My journey started in about June, July 2019, when I received my first prescription from a clinic that I found in a local area. I'd been watching the news since the law changed in November 2018, and I was just waiting for somewhere close to me that I could travel to without causing me too much discomfort, as traveling was quite a trigger at that time. luckily, something opened near me over in Manchester, and I managed to travel from where I live in York to get over there, and had my first appointment. I was almost welcomed with open arms. I sat and talked to the clinician for about an hour and a half. And we literally just talked openly about my experiences, about my use of black market cannabis and how I found it beneficial. And it was a very refreshing and kind of open situation that I hadn't experienced before. I received my prescription, and a few days later it was delivered to me. And that is really kind of the point where my life kind of changed. I started to get control of my illnesses instead of them controlling me. I started to get control of myself again. I started to kind of see little glimpses of who I used to be coming out, instead of it just being hidden and dampened behind almost like a doom and gloom of pain and fatigue and tiredness and stiffness and mood swings. And you just get trapped in this constant cycle you could never get out of. Then also all of a sudden I had this kind of window. I started seeing little changes as I started using the medication more and more. I mean, initially my prescription was a gram a day, and I'd use that vaporized, and it was flower. It was sativa flower at the time. And straight away, I noticed a difference in my energy levels. My pain levels went down. My sleep was well, first night, I just slept so solidly. And it was wonderful to kind of wake up. I woke up in the morning feeling really stiff because I'd slept so nicely. But things just started to kind of move on. Week after week after week, I could start to see symptoms kind of falling to the side and me gaining more and more control and having more energy. My young children, they commented on how much energy that I had, the fact that they're, it's almost like they were getting daddy back. And as I moved on, as time went on, month by month, I could see more and more symptoms dropping by. It wasn't really up until probably about the third month that I really kind of started to think, right, this is really got into my system now. I can see all these things happening, but now I can really feel it in my system. Everything is starting to level off, and I felt really kind of balanced, probably the most balanced I'd actually felt in my whole life, considering that I have ADHD and other conditions as well that have caused me problems in the past. My impulsivity was reduced because I was sleeping better. My moods were more controlled. My thoughts were more controlled. I was just in a better place all around, really. As time went on, I tried different strains. As I moved from clinic, I'm now on a third clinic now. Unfortunately, the first clinic I was with, unfortunately, it closed down and it wasn't able to continue. So I moved on to a different clinic where I tried different strains, moved on to another sativa strain, and instantly, just from moving on to a different sativa strain with a different balance of terpenes, and extra cannabinoids in there that I needed, I noticed an instant result in relation to stopping a symptom which was stopping me sleeping quite a lot, which was hyperhidrosis. And when I was stressed out and when I was fatigued, I would just sweat. I was absolutely drenched. I would sometimes have to get up in the night and even change the sheets, sleep on towels, and this comes out with the fatigue. Just changing to one strain with a different level of terpenes, instantly that night I had no hyperhidrosis and I had a lovely sleep again, which highlights the difference in kind of different strains and the different capabilities and finding the right one for you. And that's kind of how my journey has been. I've now moved on to trying different indica strain, which is now helping even further with my sleep. And also I feel more calm and more balanced. With my ADHD, sometimes I'd find the sativa strains a little bit too racy. I'd find my thoughts would run away with me a little bit, but with the indica strains, perfectly lovely balance. Sleeping well, energy well. I'm into a really kind of good position with my pain and stiffness, to the point where I have got myself applied to university, and I'm now doing university studies, whereas previously I would wake up in the morning and I'd be afraid to move. Now I'm getting around. I'm actually fulfilling roles in my life I want to do as a parent. Now as a student, I'm building my life back up to where it should be prior to was before I got fibromyalgia. And that is all thanks to this medication, because everything has now been rolled back. My symptoms are all manageable and controlled. It's almost, I use the cannabis like maybe say like a diabetic would maybe manage their diabetes. You know, they have a background level going in to deal with the basal level, and then as through activity or maybe different kind of carb levels, they will then introduce the insulin. For myself, it's the same kind of thing. I have a base level of cannabis going through, and then as I have activity or things get harder or I get tired, then I'll introduce some more cannabis and I can level it off. I can balance my fatigue, which used to feel like being thrown at a wall, in minutes, to a point where I can actually get back and I can get straight back onto what I was doing, and I have full energy, which is fantastic when you have small children, because they can push you to limits and you need some relief and you need something to kind of just go, okay, I need some help. I'll get this dealt with. Right, I'm back in there. Let's get on with it. And it's wonderful to be able to do that. The fact that I have this huge, lovely, soft cushion, which is this medical cannabis to fall back on now. I feel safe and I feel able to take on the world with that massive list of symptoms and things that I have to deal with. I keep on adding to them each year. I'm going to try and get it to stop. Yeah, I would not be where I am if it wasn't for this medication. And may I also add is that throughout these 2.5 years, I've never felt in a situation where I haven't been able to function whilst on this medication. I haven't been in a situation where I've felt high or out of control. I've always been level, and I've known exactly where I am at every stage, and I can deal with everything. Granted, I have illnesses, and that's going to cause difficulties, which are natural. But with cannabis, it's got my cushion. It's my crash net. It's kind of what I need, and it's turned my life around. So all I can say is thank you to the industry, and thank you to those doctors and people that are involved, like Dr. Ordman, who are getting this out to patients. Because if it wasn't for them, people like me would not be having the relief that I need to get on with my life. And that, to me, is a hugely important gift, more important than the medication itself. It's giving me back my life. And that is what we're missing from, unfortunately, mainstream medicine, and it needs to catch up. So the more people in situations like me can get the relief they need from the symptoms that are life-changing and life-destroying, to be honest. It made its dent in my life, and now it's my turn to push it back. And I'm doing it a piece at a time. And again, cannabis is my hammer. I like my analogies. So yes, in relation to ADHD as well, going into learning, I'm sat in lectures and I'm able to keep my mind on what they're saying instead of it being all over the place and kind of focusing off other little ideas and things. Impulsivity is something that's really called into control as well. I can actually have an impulsive feeling, but then actually sit there and think about it and not instantly just react. Still have the feelings, of course I have the feelings, but I can choose to react to them if I want to. And that's a wonderful thing, especially when you have issues with PTSD, which can also heighten these reactions, some impulsivity sometimes. I didn't even get a full-blown diagnosis of PTSD when I went for it as well, because cannabis is actually treating some of those symptoms. So they couldn't actually give me a full-blown diagnosis because I don't have the full requirements of that diagnosis, because cannabis is treating those. And the consultant who diagnosed me actually said, okay, yeah, that sounds feasible, even though they didn't know anything about cannabis. But I'd explained to them, I discussed it with my consultant who had prescribed it, and it made sense. So yeah, that's been my 2.5-year journey, and long may it continue, because yeah, I don't think I can handle life if this wasn't in it, to be honest. It's making it a huge benefit to my life, and I really, if anybody's thinking about this, I suggest look into it, ask questions, even if it's just picking up the phone and speaking to the clinic and saying, is this a possibility for me? Ask. Please do ask. If you're tempted, ask. Just do it. I never regret that decision at all. And I really, really mean it. If you want to try it, have a go. Please do. So yeah, thank you.
No, thank you, Stephen. That's incredible, and like beautifully summarized. It's a lot to summarize in about 5 or 10 minutes. So really well done. Thank you. I hope you don't think me rude, so I will do this for everyone. It's just, I made a couple of notes for while you were speaking about some of the things that you mentioned that I think are really interesting and sort of would probably be commonly experienced by a lot of patients. The key one being with all of your symptoms, one of the things that you talked about was control. Now, I know that the understanding that I have with my partner who's got chronic pain is that feeling that you don't have control over your body has control over you, and that's a very difficult relationship to manage. So I think that one of the things that I've found is with prescribing for patients is that sometimes they say things like, just sometimes having the medication available to me, I don't actually have to necessarily administer it as regularly as I think, but just knowing I have something available to me that will work makes me feel more confident to go out and do things I've never done before. I don't know if that's something that you or Gillian or Anne-Marie have experienced.
Definitely, yes. With the medication, it's like sometimes if you've got the medication there and you know it's going to give you relief, sometimes you feel a bit of a twinge, a little bit of a pain or a little bit of an ache coming on. You might just go, what's it doing? Oh, okay, I'll just leave it. It's fine. It's okay. I don't need to go medicate. You know, if it builds up, then at least you go, okay, fair enough. Let's go and get this dealt with and I can carry on. So you, like I say, it's a safety cushion. So it gives you that space, that freedom to make the decisions and choices that are best suited to you in that time. And that's the point. It is adaptable and it makes you adaptable by giving you that cushion.
Amusing, especially as you sort of mentioned your children, where from what I understand, the element of control is quite loose, especially with young children. Gillian, what are your thoughts on sort of the feeling of control that your medication or your prescription gives you in that respect?
It's something that I really, really like about it, is the fact that I feel like completely in control of it now, especially because it's like flour that I vaporise. So I know that when I take it, it's going to work very, very quickly. And it doesn't like stay around that long. So if I need more later, I can have it. But if I'm okay, I don't need to. I find that like so much easier to deal with than like taking tablets where, you know, the effect can last for like 8 to 12 hours. And you know, and not every day is the same with fibro. Like you get some days that are worse than others, but before I would be taking the same tablet, you know, every day, 3 times a day, regardless of how I felt. Whereas now it's like on a good day, I don't need to use as much cannabis, but in a bad day, it's there for me when I need it.
I think you raise a really interesting point there about this idea because of long-acting and short-acting pain relief. And now I'm going to ask Dr. Ordman and Dr. Barron about this idea of doctors who are looking at considering cannabis medicines for their patients, especially in pain. A lot of them are concerned about this idea of peaks and troughs in the experience of that pain management. So if you get a really instant effective pain relief, there inevitably comes sort of a drop-off point where it feels like you are going very up and down in your symptom management. So the argument would be that a lot of patients benefit from having an oil underlying that that flower to have that long-acting symptom relief. But there are patients who do manage quite effectively with flower on their own. So Dr. Ordman, I'd be really interested to hear your point of view in terms of the traditional pain management sector in this idea of short-acting pain management, whether it's cannabis or opioids. I'm just interested in your take on that.
Well, if we start with the conventional medicines, for example, the opioids, fairly standard medical practice now is to give people slow release morphine or fentanyl, whatever it is, to try and get steady levels in the body over the 24 hours so that there are no peaks of sedation and no troughs of pain control. It's all fairly steady. And for a lot of people that works extremely well. It's safer for them. They don't suddenly become drowsy half an hour after taking their medicines. They're safe to cook or look after their kids or drive or whatever. And that works very well for some people. And then they can take quick release morphine tablets or whatever if they get some extra pain or they want to do an activity that they know is painful. So the quick release medicine gives a degree of control. And I think we can transfer that model usefully to people using cannabis medicines. The slow release medications at the moment tend to be oils, cannabis oils, containing THC and CBD and terpenes and so on, which are generally taken under the tongue and they're absorbed through the lining of the mouth. And that can work extremely well for people, especially people who are new to cannabis medicines and haven't been smoking or vaporizing flower in the past. That works pretty well. And we can give them top-ups either at night through a vaporizer if they want to get a good night's sleep with a more indica sleep-inducing cultivar, or if something acutely painful happens. So the oil-flower combination is good for other people. And then I imagine people, Stephen might agree with me, people who come to us already vaporizing flower or having smoked flower, whatever it is, they're used to being really, really in control and wanting to up and down their pain levels with a degree of control and predictability. I think, as you said, Sophie, if you take quick release medicines, they work quickly and the person feels confident and they enjoy that feeling, which may be a good or a not so good thing. But then the levels fall off quite quickly within maybe a couple of hours. And some people can get a little bit hooked on the upping and downing, which rather distracts from the getting on with life, which in a way is what the pain medicines are all about and what we've heard from Stephen. So I think really if you're looking for a really good relationship between the doctor, and I should say the practice nurse, and the patient as well, to really get a feel for what the patient would like, and also we can advise them a little bit as well, however expert they are, to find the right combination of slow release and quick release preparations. I wonder if Leon has similar perceptions.
I was going to say, Leon, I was interested in sort of your experience from GP frontline of that kind of the peak and trough short-acting medication.
Yeah, of course. I mean, you have to appreciate that the majority, almost every GP is working within an NHS framework, largely the majority are, and cannabis-based medicines just aren't on their radar. So when it comes to pain control, first of all, I'd like to say our hands are often tied and we have a limited toolbox when it comes to prescribing. I also think a lot of medicines are prescribed inappropriately and not always in the best interest for patients. And there are lots of reasons for that. I could probably talk for a whole hour on that, but I think the crux of it is a 10-minute appointment focusing on one particular symptom is not conducive for good long-term holistic medical care. I think the NHS is wonderful. I think I'm very supportive of my fellow GPs and primary care, but I think there are times where it has its limits, and I believe passionately and strongly that for patients who have complex overlapping symptoms and conditions, that often this 10-minute appointment with limited toolbox of licensed medicines or off licenses is not always the answer. To answer your question about pain relief, I mean, it's very much specific to the condition and the patient and what they've tried previously. When it comes to fibromyalgia, it's difficult in primary care. I'm sure many of us know that the guidelines changed recently, and the NICE guidelines, which still largely inform prescribers, frontline prescribers, have taken this approach that with fibromyalgia, that we're kind of moving away now from opioids, from even basic medicines like paracetamol and ibuprofen, and the direction and the advice is to refer into exercise programs and CBT and acupuncture. I have to be honest, most of these things don't exist in most areas across the UK, especially in the area that I work in. So I think we're letting down a lot of patients with fibromyalgia, and I believe a lot of them are prescribed medicines that probably don't work well for them. If they're prescribed to pain clinics, they often wait months to be seen. It can take up to a year to be seen. And a lot of people are prescribed opioids or gabapentinoids or medicines that won't work well for fibromyalgia. So it very case specific, and a lot of issues. I think there's no it's hard to kind of generalize to answer your question clearly, but I just think that cannabis has a role to play. I think we all agree. I think we're all coming from the same angle on that, and I think it also has a role to play in primary care, and it would be a very useful tool for GPs.
I was just thinking, because that was another thing that Stephen said that I think was really interesting that I would like to ask you about. I think, by the way, if any of our panelists want to sort of jump in or ask anyone else a question, Stephen, before I launch, please ask or answer Leon or Dr. Ordman.
I was just going back to the point in relation to the peaks and troughs, because with cannabis, in relation to its toxicity and how the body processes it, you're actually less likely to have peaks and troughs as you are compared to have more toxic kind of drugs, because the body is trying to get it out as quickly as possible. With cannabis, because it has low toxicity levels, it's more likely to stay in your body for a long period of time. So the levels will actually build up. So the more you use it, gradually as you use it, you're less likely to get those high feelings, and you're still getting a symptom relief, but you're not getting all those negative or potentially negative feelings that you would do when you first start using it. So as it builds up and builds up, like I was saying, as I got to like month 3, as it build up in my body, and those background levels are there, it sustains you, like I say, a constant cushion. So if you don't use it for a period of time, like when I have my kids, I could get through a whole day with just one vape, which is really good going because I have that cushion from the build-up of the previous days. You wouldn't normally have that from other toxic chemicals because you'd be kind of crashing, which is exactly what happened to me when I was on tramadol. I would crash and I'd go into anxiety states and I'd be a complete mess. So the idea of this peak and trough is less there with cannabis. So if that peak and trough is there as an addiction risk, I'd suggest potentially that it's reduced by cannabis, even by using flower.
That's
Stephen,
really,
can I ask a question about your other medicines that are prescribed? Have you managed to come off other medicines or
my situation with other medication was I'd kind of run out of all my medication before I even got fibromyalgia, which is primarily a pain condition. I'd already used a tramadol, amitriptyline, baclofen, pregabalin, all these drugs, and it all had nasty, horrible side effects. I mean, they'd messed with me. I mean, I'm dyslexic, dyspraxic, ADHD. My mind was all over the place. I couldn't focus or anything. So I would kind of run out of those, and they'd stop prescribing those probably about literally a week before I actually had my accident, which triggered the fibromyalgia. So I'd actually gone into hospital 4 months later with no pain relief at all. So I was literally, I've solely used black market cannabis and cannabis medicines to treat my fibromyalgia, nothing else, because nothing else was available to me. So that's my journey, and that's why I know it works, because it's all I've had. And look at me, I'm here. I've not had anything else.
No, that's really fantastic. And I think one of the things I will probably touch on the question I was going to ask Leon a little bit later, actually, but the last thing I wanted to ask, but to draw out of your experience, Stephen, was the point that you made about 3 months in, because my experience there are 2 groups of patients. There's patients who have never experienced cannabis before, and there are patients who have been using cannabis for a long time, are very confident in their management with cannabis. And that often patients, if it doesn't have an instant effect within the first month, may drop off or may decide that this isn't worth exploring. So I'm just interested if you could share with other patients what made you feel confident to keep going for further than that month. Did you notice improvements in that first month? And what I suppose, just to explore those 2 questions, really.
It's kind of a journey, really, in relation to, it's also a comparison between black market and prescription cannabis as well, because I had been using black market before, and though I was getting a certain level of relief, I wasn't getting the relief I was going to get from prescription cannabis. And that's why I thought, look, let's just give this a chance, because it's consistent. I'm going to get the same strain all the time. I know exactly what I'm getting, and I know where it's coming from. And that's the key, the consistency and the quality. You can't get that from black market. It's consistency and quality, and that's where it really started making a difference. And that's where as you're using it regularly, as it's building up on my system, I really started to notice those results. And as I say, as each day, as each week, as each month, but it was really after that week, that 3rd month, I kind of just sat there one day thinking, wow, I really have kind of gone over the threshold here. This really has made a big dent in this. How far can I go? And it really started to make me think, right, let's see how far we can go with this. and further I went. And my dose has not changed really until over the last few months. I've actually started introducing oils. The last 2.5 years have been more or less on 1 gram of flower every single day. And as it's got into my system, has worked for my system, and I sustained this level the whole time, here I am. Everything is just gradually just reined back really gently, to the point where it's not too rushed. I can gain to control. I know exactly where I am. I know it's like I'm growing with it. It's reducing and I'm growing. And it's a strange experience, but it's a wonderful journey to be on, to be honest. Join me.
Thank you, Stephen. No, that's phenomenal. Thank you. So I just wanted to obviously give some time over to Anne-Marie. If Anne-Marie, you feel like you could share with us your patient journey with cannabis medicines, tell us a little bit about yourself. You're on mute, Anne-Marie. I'll just unmute us.
So I was a complete newbie to cannabis, unlike Stephen, and it was kind of complete desperate measures that I was in, you know, seeking help for my fibromyalgia, and it's been fantastic. You know, I actually am a patient of Dr. Ordman, and started seeing him in May of this year. When I was, you know, really completely at a loss of what to do, stuck on tramadol, you know, Oromorph for breakthrough pain, high doses of amitriptyline. I just felt like a complete zombie. I had literally no life, you know. It was terrible, really terrible. Couldn't drive. I couldn't really participate in anything to do with the family. It was just dragging me down, and it was controlling me, my fibromyalgia. And then I read an article in Fibromyalgia UK about medical cannabis with Dr. Ordman was written about in that, and I just thought, I need to try this. I need to do something. I've been to Holland and Barron and bought CBD oil. I didn't know what I was doing. I just thought, right, I'll buy the strongest one I can find and start on that and see what happens. And and then kind of did notice a slight difference, but I noticed I was wanting more and more and more of it every single day and exceeding what they'd recommended. So then I had my consultation with Dr. Ordman, and we started on some oils and some flowers, and it gradually became easier. I have completely come off tramadol and Oromorph and amitriptyline. I no longer take any of those drugs. I only take one medication for fibromyalgia, which is duloxetine, and that's a very low dose. And I'm hoping to come off that as well. And we've gradually increased my doses till I've got a really nice therapeutic level where I feel I'm in control. And that's just to sort of reinforce what Stephen said. I'm now in control of my pain and my fibromyalgia. It's not controlling me, and I'm able to do so much more. You know, I love my garden. I'm out, I can be out there, you know, for half a day now, whereas before I just couldn't do it. And there was one point when it was really bad that I just said to my husband, is this what my life's going to be like for the rest of my life? I'm 49 and I'm going to be like this, like a zombie. You know, I've come from being a professional person, the busy job, loved my job. And I've accepted that that's not going to, clinically wise, that's not going to go forward, but maybe I can do something else now, because cannabis medicine has given me the confidence and the control that I need to be able to, you know, to have those thoughts and plans. So yeah, I'd recommend it to anybody with fibromyalgia, because, you know, it's changed, I'll say it's changed my life in a nutshell. Not
Thank
really
you.
more bad than that, you know.
No, thank you. And I just want to
That's it.
say a personal thank you, because I know that Gillian and Stephen are very experienced now in telling their story, and I know that to tell it in public for the first time is incredibly difficult. So I really appreciate your bravery, because I can feel it in myself. I can feel myself feeling so emotional about it, because I'm just really happy to hear that things are getting better. And I think there are comments all in the chat here of people saying exactly the same thing about you. So I just want to let you know that. So there's a couple of things in your experience that, again, I'm going to draw out and just sort of talk about a little bit. One of them is the fact that obviously you said you didn't know anything about cannabis, and you went initially you went for CBD oil.
Yeah.
So because I think that's interesting, because a lot of patients that I know will obviously, if they haven't heard of cannabis before, the CBD oil is considered this sort of safer option, which actually in over-the-counter products may be sort of a difficult one to determine in terms of sort of strength, purity, etc.
Yeah.
So when you said you felt some benefits from it, what kind of benefits did you experience from the CBD?
But like very, very short-term kind of drops in the pain level, but really fleeting. But I think when you've got fibromyalgia, you become so attuned to your body and the pain and how you feel that you notice any slight change, you know, and I just felt myself needing more of it. And then I started to research more about cannabis oil and, you know, read about it and find out about THC and all the different components, and it kind of then spurred me on to go down the medical cannabis route, because like Stephen said, you know what you're getting, it's consistent, it's you know, it's safe. I feel very, very safe on it. I don't ever feel out of control. I can drive, I can cook a meal for the family, you know, I can do things, you know, I can operate machinery in the garden that, you know, I can do things safely without worrying at all. And I've got lots of confidence in it now. And it did take about 3 months really to reach quite a good therapeutic sort of sweet spot, I would say. Yeah, about 3 months really. And, you know, going to my GP was very much on board with it, but she didn't really know a lot about it. And I think that's such a massive gaping hole, really, that everyone you speak to, so I've had you know, hydrotherapy, my physio, my GP, my rheumatologist, they're all really, really sort of supportive of you going on this journey, but it's like a mystery to them. It's like sort of smoke and mirrors, and they don't understand it. And I think things like this are so important to raise awareness with our you know, GPs, so that more of us can, even just to get a referral, you know, so that your GP can refer you to somebody who can help you, rather than having to search it out yourself, which for some people can be extremely daunting, I think, you know.
No, I think you're totally right. I was just going to ask, actually, now you've said that, I'm saying to Leon, is what would you advise in terms of patients interacting with their GPs, or GPs who are uncertain about where to go when a patient discloses that? What's your sort of advice in terms of supporting them and each other?
So I see it from two angles. First of all, I think it's quite an ask for people to go, and, you know, not everyone's got the confidence to bring up this subject in front of their GP. They don't know what the response is going to be. They might not know that GP very well. And I think it's a big ask to try and educate your GP. And I don't personally believe that is the job of a patient. I believe that's the job of for, you know, medical schools and GP training and royal colleges. And I believe every GP needs to be informed about this, whether they endorse it or not doesn't matter, whether they have an opinion on it doesn't matter. They shouldn't impart any of that onto their patient. They just need to be informed, understand the basic concepts, understand where patients can go, understand how these medicines will or might interact with other prescribed medicines. And these are just basic things that we need to do as doctors. So my efforts really are focused on opening that conversation amongst GP colleagues. Fortunately, there's more interested, but we've got a long way to go. So the organization I put together was for that very purpose. It was just an obvious thing to do, to try and open up this conversation. And look, I mean, if patients want to go to their GPs, by all means, you can tell them about the Primary Care Cannabis Network. That's an organisation for GPs. And of course, you can refer yourself to any clinic in the UK that you wish, and the GP really should support you in that process. And if they won't, you can self-refer. But I think it's a difficult position that some patients find themselves in. And I just hope that collectively as healthcare professionals, we can try and move that conversation forwards. So it's not an easy one at times, but it's beginning to be spoken about more frequently, which is a good thing.
Yeah, definitely. I agree.
No, I think that's right. And it is very, and I think sort of don't underestimate the usefulness of having organisations like the Primary Care Cannabis Network to direct GPs to, I think, if you are ever uncertain or they seem uncertain, because I think more often than not, just having your colleagues and your peers as a clinician giving you that confidence and confirming that this is something that you can legitimately access or consider for your patient is incredibly beneficial. I just wanted to ask Mary about sort of everything because especially with things like your podcast with Cannabis Patient Voices, you come across a lot of patients who are with a huge range of different conditions that find cannabis medicines and CBD helpful. What is your sort of take on people? How do people I suppose, assess whether or not they are appropriate for a CBD product over the counter, or whether they are sort of thinking about whether they should start looking at cannabis medicines? How do you help people make that decision? Because it must be very, very challenging for patients to sort of decide when they're supposed to take that step into being clinically monitored, I suppose.
Yeah, I think it can feel like a cost thing. I mean, I've seen a few questions in the chat about how much does this cost? You know, it can be, you know, we've seen lots of stories in the media about, you know, particularly with children with epilepsy, their parents paying thousands of pounds a month. So that's quite a frightening prospect. Thankfully, I think generally for chronic pain, that's not the case. And increasingly, you know, the price has come down. I mean, I'm so overjoyed for patients that, you know, not only the prices of the medicine come down and, you know, the consultations in many places as well. So actually comparing it potentially, if you had fibromyalgia and you were taking a CBD oil, which actually isn't that cheap, really, and you were taking, you know, quite high doses a day, you might be paying the same as you were paying, you know, with a prescription for medicinal cannabis. And so for me, you know, I've gone from being very much embedded within the CBD industry to now, if I were in a patient's situation who'd even been, you know, are getting, you know, okay results with CBD, I would seriously consider going down the medicinal cannabis route, because you are under the care of a doctor. You know, everything that, you know, the Stephen and Anne-Marie have said about, and Gillian, about, you know, it's, you know what you're getting. And the thing with the CBD industry is that something that most people don't know actually is all the products are white labeled. So what I mean by that is that the companies buy their products from Europe mostly and stick their labels on, and often they don't even know what's in them, frankly. You know, the reason why when you go to Holland & Barrett and it doesn't tell you what's in the product is probably they don't know what's in the product. So really, you know, if you are a patient, you need to know not only, you know, how much CBD is in it. Ideally, you want to have something that's full, whole plant, a full spectrum product that has the full array of cannabinoids. It has, you know, a decent amount of terpenes in. I mean, unfortunately, I don't know if this is the case with medicinal products, but often through the extraction process, you know, terpenes are very volatile. So actually, they have to be kind of added back in. So it's a little bit of a kind of false rumor that, you know, that you're getting the sort of full, you know, spectrum of molecules as they appear in the plant. That's actually not always the case. So also kind of another thing with the CBD industry right now is that, you know, it's isolate products which are tending to dominate. So actually, you know, getting a full spectrum product is a decent one, is becoming increasingly more difficult, and one that also includes a small amount of THC. So, you know, I really encourage patients, you know, just to think about, you know, going the medicinal route, because something also that's very, very important, you know, most fibro patients are going to be taking huge amounts of, as we discussed, opiates, gabapentin, all sorts of things, antidepressants, etc. And you need to know what are the drug interactions? And if you're popping down to, you know, a Holland and Barrett or buying something off the internet and you're not under the care of a doctor, you don't know how they're going to interact. Probably has been no problem at all, but it's always, always best to be under the care of a health professional. So I feel rather bad, you know, after having my, you know, my CBD book, the Essential Guide to CBD Oil, but, you know, it's really, really, really important. You know, if it's at all affordable. And I've seen someone mention about, is there, you know, schemes or ways to get, you know, sort of more affordable access. And I encourage patients to check out Project 2021 as well, which is a way to get subsidized access to medicinal products. I don't know if that answers the question, but
no, I think because when you say, you know, I feel guilty with my CBD, but no, I think because this is why it's so valuable to have you here, because I think a lot of patients start where you're talking from, with all the patients.
And to be fair, you know, there's a lot of patients, you know, there's a very active CBD community of patients, many of whom have fibromyalgia, and actually some of them do get, you know, great results. So, you know, I would, again, you know, if you, a bit like Anne-Marie, okay, she felt a little bit of a difference. You know, it may have been that she was trying the wrong CBD product. So, you know, by all means, you know, try one CBD product, try another. You know, there are another important thing, you know, it's, for me, calling it CBD oil isn't correct anyway. A decent product is a hemp extract that's got other stuff in as well. It might be one that has, you know, CBDA in. You know, some patients find CBDA really helpful. So, you know, you can experiment first of all within the over-the-counter market. But I would definitely encourage people to you know, be under the care of a doctor, you know, or a nurse like lovely Sophie, who knows, you know, who knows what they're doing.
Thank you. I appreciate that. Thank you. I think that's a really important point about that. I think that another one of these things attached to that importance of the emphasis of the importance of being under a doctor, especially if you do have complex health conditions like fibromyalgia, and like Stephen and Anne-Marie sort of talks about, there are additional sort of diagnoses that come along with fibromyalgia. I was wondering, Dr. Ordman, because I think Anne-Marie highlighted the fact that you've obviously successfully come off of a lot of medications, a lot of opioids that were sort of causing you a lot of distress. I think by the sounds of it, was causing a lot of disengagement for what was happening to you in your life. And I just wanted to know from Dr. Ordman how you might advise either patients or clinicians to titrate, how you might safely bring that down, the advice you could give for safely reducing your opioid intake with cannabis medicines.
Well, I'll gladly answer that question. I will say that from my extensive experience in the NHS pain clinic, those medicines, the morphines and the gabapentin and so on, and the amitriptylines, do not help with fibromyalgia, but they take things away from the patients. They take away their memory and their alertness, and I call it zombification, and I think there's some truth in that. So one of the good things about cannabis medicines is that they don't generally violently interact with those medicines. So the patients can stay on those medicines, certainly for the first couple of months that they're taking the cannabis medicines. I generally warn them to be a bit careful. They may extra sedate you or extra do this. Be terribly careful if you're driving or cooking or whatever. Around about month 2, month 3, when the patients are feeling the benefits of the cannabis medicines, we can begin to think about reducing those standard medical products, morphine and so on. Morphine you can probably safely reduce by about a quarter of the dose every 2 or 3 weeks. So and you don't get withdrawal symptoms if you just reduce by about a quarter each time. So you can slowly reduce it at your own pace, and cannabis helps you not to miss the opioid. So it's a really good way of doing it. And to some extent, the same goes for the gabapentinoids, pregabalin, gabapentin, which are much more addictive in my view than cannabis medicines. I think it's probably worth reducing only one medication at a time, and doing it slowly by quarters or thirds over every 2 or 3 weeks or every month. Duloxetine takes even longer. And amitriptyline, that tiny little innocent looking tablet, isn't. It's sneaky, and it takes away your energy and your memory and everything else, especially for older people. And so I'm rather hoping that by about 6 or 9 months of using cannabis medicines, people are off all those others. Now that's the advice, but people can find out for themselves. I think we heard from Anne-Marie earlier that, well, she just sort of stopped using them gradually and that was fine. Is that correct, Anne-Marie? And it's sort of how it worked.
No, what I did was I spoke with my GP about it, and obviously yourself. And we have a pharmacist in our medical practice who also helped me out, and I reduced them very, very slowly. The amitriptyline, I was reducing it by 10 milligrams every 4 weeks. So it was slow, but I was able to cope with it that way, and I could see the benefit in myself, you know. So I was working when there was a crossover of this sleep of sort of when you come completely off it, what's going to happen, and it was a little bit touch and go for, you know, a few days, but a few evenings, but the cannabis soon takes over, and you because you listen to your body and how it feels with the cannabis, you know, you can kind of up it, lower it within reason, you know, in a sensible way, and get over that little blip, and that's how I did it. So
you did very well.
Yeah, congratulations. I think there's lots of people asking questions similarly, so hopefully that conversation has sort of helped answer a few of those questions. Gillian, I would love for you, if you are happy to do so, to share your cannabis patient journey with us, if you're happy to start.
Yeah, sure, thanks. So I've been prescribed cannabis for a little over 1.5 years now. When I first got prescribed it, because I've got quite a lot of children that I've got to look after, and they're all autistic as well, my doctor wanted to start me off on a CBD oil first, because I had so many caring responsibilities and things. I tried that for the month and it was okay. I felt my anxiety reduced slightly, but it didn't really help with pain or sleep or anything like that. So the next month they then introduced a THC oil and a CBD oil. I found that a lot better. My pain was like managed a bit better and things like that. But I found it quite difficult to go from the waking up in the morning until the oil had taken effect, because that was like the busiest time of day in my house, is when all the kids are up and needing to get ready and things. So I couldn't, although I could feel better later in the day, I couldn't feel okay in the morning when I really needed to. So that's when he introduced some flour to vaporise as well. But that month where I was getting the oils and the flour was fine till I discovered how much that was going to cost me. And unfortunately, although that month was the best I've ever felt, it wasn't sustainable. And I had to then make a decision about, I can have one or the other. I can have flour or oils. I can't afford both. So between talking to the doctor, it was then changed to a kind of different conversation of what's best to, right, what can we afford to make things most manageable for you? So I decided then that flour was probably going to be better because I could use it as and when needed. You know, so if I didn't need it, I maybe wouldn't need as much flour that month as the next month and things like that. Whereas with the oil, I would need to dose it, you know, every day. Which is, I mean, life is so much better now than before it. You know, because I've got my appetite back, so I could get to a healthy weight, whereas before I was just feeling nauseous all the time. I didn't want to eat. I couldn't do much with my children. I wasn't enjoying the time I was spending with them because I was so sore and things like that. Whereas now, you know, I can read my son a story, I can take them at the park, I can take them to school, I can go down when they're having problems at school and, you know, actually speak to the staff, you know, a lot better and things like that, which I've really, really needed because my kids have been having a hard time at school and things. And there's a lot of like communication I need to do with the school that I wasn't really up for doing before. So like all that's got better. I'm just not quite at the stage yet where everything's manageable, but I'm hoping that in the future, as costs come down, you know, that I'll be able to hit that sweet spot as well, you know. But like, as much as like I can't get to that, where I can get to is, you know, far better than what it ever was before. You know, like I wish I'd had it years ago, and then I wouldn't have had to have missed out all these years of my kids growing up, you know, and things that I missed, like school shows that I wasn't well enough to go to, you know, and just all sorts of things that, you know, you'd like to do that you can't. So it's, yeah, life is a lot better now with it.
No, I'm really glad to hear that. I think you've raised a couple of really important points. One of them was this idea of that's often sort of considered in the clinics surrounding children and safeguarding and cannabis medicine. And I think that because of its categorization as an unlicensed specialist medication, that doctors can be very sort of nervous about prescribing for parents, I think, especially with young children. But actually your sort of story is that you're saying that actually it makes you much more sort of engaged, and actually it helps you quite a lot.
Yeah, and I found it quite funny as well that he was even concerned about me being able to cope with the children, because, you know, I'd been prescribed, you know, tramadol, pregabalin, gabapentin, which made me, in my opinion, a terrible parent. You know, I wasn't able to be there and be present for my kids. I wasn't making good decisions, you know, any of that stuff. I was too ashamed to go down to the school to pick them up because I was staggering, my speech was slurred. But that seemed to be quite acceptable. So I found it quite strange then that my doctor all of a sudden was like, you know, going, you know, we don't want you being wasted. Because, you know, I'd been wasted for years on all that stuff. So it's actually quite nice to not feel that, you know, and I know what's going on, and, you know, I can make better decisions, and, you know.
Yeah, I think that leads on to something else that I think I was going to ask Leon about earlier, but it seems the right time now, which is sort of that Leon sort of talked about cannabis being available in primary care, and that would be ideal, because I think a lot of the time, like you say, that the first line of treatment can be relatively strong painkillers that have that effect on you and affect your quality of life. So I'd be interested, Leon, what you're sort of develop that further in terms of arguments for why it would be helpful for cannabis medicines to be more available as a primary care option rather than having to reach specialist physicians.
Well, I mean, the reasons are quite obvious just from the discussion we've had this evening, that it works very well for a lot of people. It's not for everyone, but I think for chronic pain, mood disorders, sleep, lots of overlapping conditions that people suffer with. If you're in pain, you're inevitably more anxious, or you perhaps low in mood and so on. And that's where it really seems to work well for a lot of people. And this is bread and butter GP work. I mean, this is what we do day to day. You know, that's the core of being a good GP, is to manage long-term problems, overlapping problems. Of course, we do acute medicine as well, but it just seems to have a very important role in medicine, in frontline medicine, in primary care. To get it there is a complicated journey, I think, because the regulators, and particularly NICE, who look at cost effectiveness and evidence, have come to the conclusion that there isn't enough evidence for cannabis-based medicines. They're not cost effective. There are lots of unknowns around its use, because it's seen as perhaps a new treatment or a novel medicine. So, and there's others that just don't, I think, even view it as a medicine. That's the other thing that we're tackling. So to get those issues addressed does not happen overnight. There's a lot of conversations to be had. There's a lot of data that needs to be looked at. Lots of toing and froing and differences of opinion. And And you know, people have spoken about this at great length, that cannabis in a whole plant extract in an oil form is very different to a licensed pharmaceutical medicine that's been through large clinical trials. You know, they're full of active compounds and interesting therapeutic ingredients, and it's very hard to run those types of products through large studies. And what's clear as well, just from talking to you guys this evening, is everyone responds differently to a different product or a different strain or a different chemovar, or you know, an oil or a flower. So how on earth do you put that into our current system? And I suspect it's going to have to find its own place in medicine. I'm not sure it would necessarily just overnight appear in our, you know, in mainstream clinical medicine. It might have to sit in a subcategory, but we've got used to that with other areas of medicine. I mean, we can find a place for it, I hope, and maybe just accept its limitations, or accept that it's different to the other product, the other things that we prescribe. But there will be a number of doctors that are interested in learning about it and prescribing it for patients. So I think we're a long way off NHS access, if I'm honest, around whole plant products. But we might potentially see some GP prescribing, albeit perhaps in a semi-private capacity initially. But long term, I think we might start to see NHS access, and that will probably come from health economic arguments. So as more people are accessing cannabis-based medicines, particularly if we're open-minded and we look abroad and we look at data from outside of the UK, that I think the data is already there, and it's quite obvious to many of us that there are huge cost savings. And I also believe that cannabis-based medicines can improve GP workload. They can save money in primary care. They can improve outcomes for patients. They can reduce hospital admissions. It could potentially reduce referrals to secondary care. But it's all well saying that, and I believe it, but we don't at the moment have enough solid evidence, if you like, to back that up.
No, thank you. I think, Dr. Ordman, I can see you nodding along enthusiastically. I wondered if you had anything to add to what Leon was saying regarding this particular idea, especially as someone who's now regularly prescribed both strong opioids regularly and now cannabis medicines comparatively for people like Anne-Marie and Stephen. You're muted.
I think it'd be very appropriate with time, and not too much time, for specialists, those interested like Leon, to be able to prescribe from their place in general practice. It is a general practice sort of drug, really. It's safer than many of the medications that GPs regularly prescribe. So I don't see a problem with that. We recently, Sophie and I, you and I were at a meeting, Leon was there, where we were able to discuss with the director of policy for NICE. NICE is the organization that's gatekeeper to which treatments are available on the NHS. And we were able, he very generously and kindly came to our meeting about cannabis medicines and spoke to us. But he also listened to us. And when we were able to say, we think that the evidence that they were trying to use, for very understandable reasons, wasn't the best evidence, because the best drugs weren't being used, the best cannabis drugs weren't being used yet to do that research. And maybe we can begin to do that research so that NICE will listen. They will see the cost effectiveness and the safety of our cannabis medicines. There'll then be savings on the other medicines, as we've heard from Stephen and Anne-Marie in particular, and Gillian. They'll come off all those other expensive medicines. So I think if groups of us can get together and work in that way to provide the evidence that NICE needs, then there are ways forward, and people like Leon can be prescribing from general practice. I don't see a problem with that.
No, I totally agree. I think it is about, unfortunately, working within the system. I think as clinicians, we're, especially in the medical cannabis space, we're challenged quite often with this idea of this immediate need for many, many patients, like Gillian and Anne-Marie and Stephen, where you want to be able to provide that relief as effectively as possible, but also you need to understand that in order to get it to be accessible for as many patients as possible via the NHS, there is within the UK a very strict system of how that becomes the case. So it's a very difficult situation, isn't it, as clinically to sort of try and navigate that. I know, Gillian, you sort of have had a whole week last week of PLEA sort of talking about issues exactly like this. So patients are very passionate about how we constructively can move forwards. Gillian, the other thing that I wanted to pull out of your particular experience as well, which I think was mirrored by Anne-Marie as well, which was talking about, you said you made that your doctor talked about being wasted and you didn't want you to be wasted on cannabis. And I just wanted to highlight this idea of a therapeutic level, because it was something that Anne-Marie said, it's something that you mentioned briefly, and the importance of what that actually means when it comes to cannabis, because I think doctors and nurses and GP, that we all sort of hear this word high and have incredibly negative connotations of it. So I just wanted to hear from you, Gillian, about this idea of what, and I would like that to hear from Anne-Marie and Stephen as well about exactly this, about the idea of being high and what you consider a therapeutic level, because doctors and patients may have slightly different ideas of what that means.
Yeah, well, I guess to me a therapeutic level is just, getting to a point where I don't feel like I'm going to throw up and my pain's lessened. And if I can achieve that, brilliant. I'm good to go. I've not really, I don't really enjoy being out of it. I don't drink alcohol and things like that for the same reason, because it makes me feel really, really anxious if I'm not, quite in control of myself. So it's not something I'm really wanting to be doing. There has been times where I've vaporized a bit more than I would like to, and I've just had to go and sit down for 10 minutes. But the rest has done me good at the same time, so, I mean, even if I am high, I sit down on the couch for 10, 15 minutes, that's no bad thing. I don't get much chance to stop because of the nature of my house. So I wouldn't say that that's a bad thing or, something to be concerned about. And especially if you're vaporizing, even if you were to get high off it, it's not going to last very long. Do you know what I mean? It's not like, taking, your tramadol and then that's you, for 6 hours, you're out the game. So I don't think it's not as much a dangerous thing if you do have a bit more than, a therapeutic dose.
No, because I think that's interesting, because I think that, again, a lot of people who haven't experienced chronic pain can't or struggle to appreciate how cognitively impairing chronic pain is. And I think that actually, when we talk about this feeling of being high, actually most patients, and Dr. Ordman will be able to sort of highlight this a little bit better, I think, which is that patients who are in chronic pain and patients and individuals who may not have any particular diagnoses, if you give them the same amount of THC or CBD or cannabis as a whole, they will be affected in very different ways. So someone who is, in inverted commas, healthy would probably experience that high sensation much more readily than someone like yourself or Stephen or Anne-Marie, because you have this, you're trying to sort of supplement your endocannabinoid system. And I think that is a really important factor, that actually chronic pain is incredibly cognitively impairing. I think you're all very nodding sort of enthusiastically, so I hope that I've got that right. Anne-Marie, I would like to hear your thoughts on this idea of a high and therapeutic level and what that meant for you, because I think that was your exact phrase, actually.
Yeah, I think I would sort of reinforce what Gillian said, is being out of pain, or in a pain that's controlled, because chronic pain makes you out of control. It makes, so the cannabis brings the control back in, and you soon realize that when you're on that journey, when you're on that journey with the cannabis medicine. So it's a lot safer, and this sort of worry that people get high or patients will get high. It's not the case in my experience with fibromyalgia at all. I don't think I've ever felt high on it. The most I felt is sleepy, and that's when I take my nighttime oil, and it helps me just drift off into a nice sleep. So, you know, it's definitely not any point where I felt out of control of myself. Much more with the traditional medicines, to be honest, way more.
No, thank you. I think, and actually the effect, you're actually saying that the sleep was the desired effect of the medication you were taking. So actually that was actually the optimum like result, I suppose. Thank you. Stephen, just quickly, what are your thoughts of this idea of a therapeutic level?
I think we need to understand that the purpose of taking medical cannabis is for symptom relief, and the purpose of using recreational cannabis is to get high. That's very, very different, and they're used in very, very different ways because of that. In relation to the idea of getting high, though, is that it's not really high. It's called a state of bliss. It's anandamide, anand being Sanskrit for bliss. And that's what we're actually replacing in our bodies when we're using THC, is that lost anandamide. So as somebody who has fibromyalgia or other conditions that can affect your levels of anandamide, all you're actually doing is treating a deficiency. As that deficiency gets up to where it should be, then you're going to start to get symptom relief, not feeling high. As Sophie said, is that someone who doesn't have these issues, they use cannabis, they're more likely to get high. Why? Because they're pushing their anandamide levels further than they would normally be. And so you get that state, that heightened state of blissfulness. It's also the kind of the same thing in relation to what Gillian said earlier, and also Anne-Marie stated too, is the fact that you can actually focus on yourself and on your illnesses. There's also this idea that cannabis makes you paranoid. I don't agree with that. It makes you self-aware, which is a beautiful thing to have in your kind of a bow on your string, or a string on your bow or whatever, to have when you have chronic illness, to be self-aware, to know when you need to stop, to be aware when you're hitting your limits. This is a wonderful medicine for trauma-based illnesses. Because of that anandamide level to balance you out, you don't get high, you balance yourself out, you feel like you can cope. Again, I go back to this crash mat, this cushion, and that's exactly what anandamide, our endocannabinoidal system, does to our body. It's a regulatory system that offers us a cushion so we can cope with life. That goes out of kilter, so does everything else.
Beautifully put, beautifully put. No, I think that's absolutely right. And actually leads what you just said about trauma-based conditions is really interesting. So I think that I'm gonna, if all panelists are happy, I'm gonna leap into the questions because I've got a lot of them and I still don't think I've even got all of them. So one of them is, I'm gonna ask Gillian first, can cannabis help or affect psychiatric symptoms like depression or anxiety? And obviously, Gillian, you're talking from PTSD, so please, your thoughts on that.
Absolutely, it's helped with that more than anything else I've ever tried. I had quite severe PTSD in that I would get really, really bad nightmares, and I would get a lot of like flashbacks during the day as well to things that have happened. When I'm medicating with cannabis, these thoughts just aren't there, which is like so good because I can think about other things instead. You know, and I can sleep, and I'm not scared to go to sleep anymore because I know that when I shut my eyes, it's going to be okay. Which after years and years of, you know, not being able to sleep or being terrified of going to sleep for the things that's going to flash into my head, it's amazing. You know, I find it quite hard to put into words, like the difference that it makes. You know, and for things like, you know, depression, like I don't feel that way. Do you know what I mean? I don't have suicidal thoughts anymore, you know, because I quite enjoy life, you know. It's good, and I don't feel as anxious or anything, you know, and I'm getting to do all these things that I would normally have never done. You know, I'm volunteering with PLEA now, and I would never have considered doing anything like that, or like talking on these webinars or things. Like it just lets you have that bit of life back.
No, you are a beautiful public speaker. Thank you. No, I think that is
Thank
true.
you.
That, I hope that answers that question for that individual. Actually, what you said there was really interesting. Leads me on to a question I'm going to ask Dr. Ordman actually about sleep. And I think that the question is, I've read that cannabis can mess up your deep sleep and REM cycles. Is this true? So, Dr. Ordman, your thoughts on that? Are you going to? This is Dr. Ordman's favorite book, by the way, that we're going to produce here right now. Sorry, Dr. Ordman, you're muted if you're sharing with us. Still muted, Dr. Ordman, if you're sharing. There we go.
Okay, sorry about that. There's a wonderful book that everybody should read. I've got a copy up there called Why We Sleep by Matthew Walker. Do read it. It's very easy to read. And we learned that sleep isn't just sort of lying there. Your brain goes through various activities, including cleaning your neurons of toxins, and dreaming, which is actually work, and also transferring short-term memory to long-term memory. To have a good day the next day, and to have a clear mind, and to be in control of yourself and your emotions, because we've heard a bit about this, you need to go through healthy sleep stages. You can't do that if you're in severe pain, nor can you do it because of some of those ruddy medicines that doctors like me, the conventional medicines, used to prescribe. They stop you dreaming. The great thing about cannabis medicines is they seem to allow you normal, healthy, physiological sleep with dreaming and relaxation. And relaxation relaxes your muscles, which is what fibromyalgia is about. So cannabis medicines, through promoting good sleep as well as their own actions, tackle so many of those fibro symptoms, the pain in your limbs and your back, the brain fog, the not being in control, the having no energy during the day, waking up unrefreshed. So thank you for asking me about sleep. It's difficult to stop me talking about it now, but I think that cannabis medicines really do sort out sleep in a healthy way for fibromyalgia patients, particularly if they can come off those ruddy other medicines which stop you having healthy sleep. They may make you unconscious and drool on the pillow a little bit, but they don't actually send you through those healthy sleep rhythms that you need to have a good day the next day.
Thank you. And I think that's one of the things that I've learned whilst working at Integro with chronic pain, because my background is acute pain, A&E, ITU, and this understanding of this relationship between chronic pain and sleep and things like fibromyalgia, which have all these additional mental health symptoms and joint symptoms as well, has been really fascinating for me. And I think one of the most interesting things for me about cannabis medicines has been this multi-symptom management that cannabis is able to achieve, particularly with things like fibromyalgia. So I think I've got another question here. I'm going to ask Mary actually. So I've got a question here that says, since it's so hard to find CBD and THC along with CBG in cannabis flowers, can hemp CBD be mixed with cannabis THC while smoking? So I think it's, can you use the idea of using CBD oil alongside prescribed THC cannabis medicines, and if there's a benefit to that, I suppose.
I would say yes. I mean, I think I remember reading that question. I think she was asking about, about the different cultivars. I mean, the thing with your CBD products that you can buy, it's a very limited number of cultivars that they come from, because they have to have this below 0.3% or 2% THC. Yeah, so you might have, I think she was also asking the question about, is it the same, like,
the difference between hemp and cannabis? Can you
exactly
highlight that, I think?
Yeah, so hemp is what has been used for thousands of years, in particular for fiber and seeds and stuff like that. And it's cannabis sativa, it's sativa, I'm used to saying it the Spanish way, but it's the same, but it has very, very low levels of THC. So if you have a decent, kind of full spectrum product, it's going to be okay if it's from hemp. That's why I was talking about the hemp extracts. In terms of using it alongside a product with THC, that will be fine. I mean, you're going to be kind of trying it out and yourself and listening to your body, etc. But I always encourage people to try and go for a full spectrum product if they can, and look for lab tests. Basically, you know, always go look on your website of the company you're buying from. Does it have lab tests? Are the lab tests for the batch that you're buying? Because they can be a little bit shady with the lab tests, and if you have a lab test, it should show you exactly not just the CBD, it's whether it's got the other minor cannabinoids, which may be CBG. Actually, I know some companies are mixing CBD and CBG. So yeah, always look for a lab test. I don't know if that answers the question, but I tried.
No, I hope so. Thank you. It's a very comprehensive answer. So I think for Leon or Dr. Ordman, I think this is an interesting one for fibro, I think. Can we talk about cannabis products or cannabis medications and digestion? Because I suffer from gastroparesis. So Leon or Dr. Ordman, whoever feels comfortable answering that question, I think would be helpful.
Well, certainly, Sophie, you're so modest, you know more about this than I do, but certainly I think THC can stimulate the gut, whereas so many conventional medicines slow the gut down. THC in particular can speed it up. And sometimes we do use that in our clinic to speed the gut up a little bit if constipation is a problem, for example, or if there is a degree of gastroparesis. I think if you have a true diagnosis of gastroparesis, maybe there's some of the nerves are missing from the stomach, one should go very, very carefully, because you don't want to drive part of the gut fast when another part's not working. That could really cause a lot of discomfort and so on. But the short answer is yes, that THC starting with very low amounts could be useful. I think that's true. I wonder if my colleague would agree.
Leon, you're muted.
I'll be honest, I don't know enough about the specific cannabinoids and how they affect gastroparesis. What I do know is that people who suffer with this condition have sometimes been prescribed opioids and medicines that very much upset, you know, can really upset the bowel and can lead to all kinds of terrible problems. So from speaking to a few patients who have this condition, they found that there have been some cannabis-based medicines that are very helpful in that sense. But I don't know exactly the products they're taking or the specific components of what they're that they're using.
No, thank you. That's really honest. I think one of the things that I was always taught in my nurse training was, if you don't necessarily know the answer, you know that someone will, and you should tell someone, and you should ask someone. So I think that that's the beauty of working and having webinars like this, is that you are learning. We're all learning from each other all the time. So I think that's really important. I was just going to ask some really sort of simplistic questions here about this. Things like, one of the questions was, are you still able to drive whilst using cannabis medicine? So if anyone is sort of confident to answer that particular question, Dr. Ordman maybe, oh, Stephen's hand went up straight up. Please do answer the question.
Well, I've literally just been cleared by the DVA, so yes, you can. I basically contacted them, told them what I was taking. They obviously did their investigations with GP, with doctors, etc., and I received my license. I have to have it checked every 5 years because I have the conditions that I have, but yes, you can. So that's my answer.
Perfect. And then the other question again is, do you have to inform your employer if you're on prescribed cannabis? I think anyone feel confident answering that one?
We do. In our clinic, we tend to advise it, and I'll tell you why. I don't believe, for the most part, that being on the right dose of the right cannabis medicine impairs your performance at work. I think that's been our experience. But we're not only dealing with our realities and our real observations, we're dealing with other people's prejudice out there in the world. And I think very often the wisdom of telling your employer is not because you're going to be impaired by your medicines, but if they were to find out and you hadn't told them, their imagination may go wild and they'll have all sorts of crazy ideas about what you're doing. So it's better to be open and preempt any difficulties, and then if necessary, provide some educational material for your employer so they can see that you're getting your medicine maybe from a CQC registered clinic, you know, and that can help them. just in the same way as we need to help doctors who are not that well educated about cannabis medicines, we can help to educate employers as well by being open and by telling them.
No, I think that's absolutely right. And I think it's also sort of, I know a lot of professions will include things like occupational health, where these are places where you can go and talk quite openly about these kind of medications and how they may affect your role. I just wanted to sort of finish up before we finish up, just by asking Stephen, Gillian and Anne-Marie, just to sort of highlight a couple of the things or a couple of the key symptoms that you found your cannabis prescription helps you with, because I think that's a lot of the questions that have come through, is that will it help with my sleep, will it help with pain, will it help with nausea, anxiety? So if you guys are comfortable, Stephen, maybe we'll start with you, if you can highlight some of the things that it helps you with.
Well, yeah, massively sleep. I sleep so much better. Pain is massively reduced. Stiffness is reduced. My mood swings, my mood are leveled. My energy levels are completely massively in control. There are so many symptoms that it's actually dealt with. And my weight is regulated. My stomach is less painful with the IBS symptoms. That is kind of controlled now a lot better. I have Raynaud's symptoms as well, which are more controlled because I can keep my stress levels down. It's just the list is never ending. And I suppose it's dependent on the person, I suppose, but yeah, it's kind of a never ending for me.
No, I think because that's why I've asked all three of you, because you're absolutely right. Everyone is slightly different, will respond very differently to different things, but thank you. That's really helpful. Gillian, if you could do a similar thing as Stephen, sort of highlight what your key things that it helps you with.
Yeah, the thing it helps the most with is nausea, because I feel like it just completely takes it away. I can go from feeling very, very sick to just not at all. Whereas my pain's reduced, but it's still hanging about. Sleep as well has just, massively got better. And yet my stomach as well, I think just because I can eat now. So I don't know whether it's the cannabis that's helped my stomach or the fact that I can actually eat properly that's helped my stomach, but either way it wouldn't happen without the cannabis. So it's been the main helps.
Oh, fantastic, thank you. And Anne-Marie, the same question.
I think really pain and sleep, the biggest things, and the feeling of muscles being very, very tight and kind of, I don't know how to describe it before you feel like you're being pulled into your spine, into your spinal cord, everything's going in because your muscles and your long muscles, well, I used to feel my long muscles really tight so that they were so painful, that feeling, and despite doing stretching and trying, it wouldn't resolve. The cannabis medicine has really helped with that, and then in turn pain relief. So yeah, those things really.
No, thank you. That's really helpful. Thank you, everyone. I just want to say, thank you for really brilliant questions from you guys. Really interesting discussion. I really apologize if we have run out of time to answer your question. We hope you found the session useful. If there was any questions that you didn't manage to get answered, please, there will be the contact details for Integro Clinics in an email that goes out at the end of this webinar, and obviously all the websites for the organizations that have taken part in collaborating. So if you do have any questions, please contact Integro or any of the organizations that we've mentioned tonight with them. I just want to finally finish up and bring the session to a close by asking all of our panelists what you would like from this evening session, the audience's takeaway to be from this evening. Mary, could we start with yourself?
I'll unmute maybe as a start. I think take that first step, just explore, take that first step. I really feel like you've literally got nothing to lose, and everything to gain.
Beautiful, thank you. Gillian, your thoughts, takeaways for the audience?
I think pretty much that if you're suffering with pain, things like that, then yeah, to try and, make contact with a clinic and look into what's available, because there's lots of different options and lots of different clinics that you know, you'll probably be able to find something that, you know, can accommodate you.
Perfect. Thank you so much. Leon, Dr. Barron, final thoughts for this evening. Now I'll ask you to unmute.
Sorry, I should be well versed in this by now. What are we, an hour and a half in? Look, for people out there, patients, anyone out there who's suffering and feels like they're, you know, that they're not doing well on conventional medicines and are interested in cannabis-based medicines, you're not alone. There's a growing community of people out there, patient groups, doctors, everyone's sort of looking at this collectively. And if you're not getting support from your own GP, perhaps see a different GP in the practice. If that fails, look into the clinics, speak to patient groups. You'll find a way to learn more about it and to work out where the access points are for you. I think this is a human problem. It's not just unique. You know, we talk about patients and doctors. We're all patients at some point in our lives, and I certainly would want access to this sort of medicine when I need it one day, and my loved ones. So I'd like to think there's a community of us now that are looking at this in the same way, and we should just try and keep talking about it and help to try to improve access to those people that need it most.
Perfect. Thank you. Absolutely. You're not alone is a really perfect summary, I think, for both clinicians and patients, humans alike. I think that's really important. Anne-Marie, final thoughts for our audience from this evening.
If you're, you know, in a situation similar to what I was in, just, you know, on conventional medicines, and you feel pretty desperate, don't give up hope, because there is help out there, and just try to have the confidence to go after it. You know, speak to other people, speak to your GP, speak to other health professionals. It's amazing how these conversations can sort of lead you to the right path that you need. So don't give up.
Thank you. Don't give up. Absolutely. There is always another option for you. Thank you. So, and then Dr. Ordman, final thoughts for this evening.
Oh, follow that. That's difficult. Well, a lot of people need liberating from fibromyalgia, and a lot of people need liberating from the medicines they've been given for fibromyalgia by very well-meaning doctors. And there are better medicines, and we've just spent an hour and a half talking about them.
Perfect. Thank you. And finally, Stephen, final thoughts for this evening.
Yeah, kind of reiterating what everyone else has said, don't give in. Don't take no for an answer. If you feel that this medicine could be work for you, then trust yourself. You're right. You know, make the steps, ask the questions, do the research. It's all out there. That's exactly what I did. And there's more availability to that information. There's more clinics that are available now than I had 2.5 years ago. So you're in a better position than I was 2.5 years ago. And look where I am now. This could be you. You know, this could be you.
Yeah, and it's legal. One or two questions.
Yes, yes.
It is definitely legal. Stephen, thank you to finish on such certainty. I love that. So I think that just to summarize, just as a reminder for everyone, that part 1 of our fibromyalgia webinar, if you missed it, with Dr. Ordman and Dr. Ethan Russo, is now available to watch on all collaborating organizations platforms, and that part 2, this episode, will also be made available in the next week or so. Another final thank you to all our panelists for sharing, educating us this evening. Thank you to everyone who's attended and got involved in the chat, and please keep an eye out for the recording coming available soon. Thank you very much, guys. I really appreciate you for joining us this evening. Thank you very much.